and this is your femoral vein. Okay? Now, like I said, always confirm that your femoral vein is patent.
First of all, I would like to thank Oriol for giving us this opportunity to learn about EVLT, and especially Dr. Maunal, who had explained each and every step of the procedure in detail and in a very comprehensive manner, so that we could actually know exactly what to do and exactly what not to do.
We have got a wonderful opportunity to have this kind of varicose vein, and we have encountered a lot of, more than 9 cases in a day, that too difficult cases. And
It's an excellent program. So many cases wonderfully demonstrated, especially the use of ultrasound in varicose veins.
Find that the patient says, no, I don't have money for MRI. Then what to do?
Very informative, and we have got the chance to witness around 8 cases. And
വളരെ നല്ല ക്ലാസ് ആയിരുന്നു. അതിൽ നിന്ന് ഒത്തിരി പോയിന്റുകൾ സ്വീകരിക്കാൻ കഴിഞ്ഞു.
Oriol Medline, where science cures and cares.